I'm Dr. Steve Gange, a urologist with Summit Urology Group here in Salt Lake City. So ED stands for erectile dysfunction, and it wasn't called that 20 years ago, it was called impotence. And the causes of ED, erectile dysfunction, include mostly vascular things, because an erection is just the influx of blood into the penis. So patients with heart disease or hypertension, even diabetes can affect blood flow. Beyond that, cigarette smoking. Every time one inhales a puff of a cigarette, there's a constriction of blood flow. Low testosterone really mostly impacts libido or desire, not so much erections. And of all the people with erectile dysfunction, only a sliver of patients, 5%, have, as the cause of their erectile dysfunction, a low testosterone level. So prior to the 1990s, honestly, the only real proven treatment was the insertion of a device inside the penis called inflatable penile prosthesis. Those are still being performed today, but that's a big step from a guy who's just having a little trouble in the bedroom to undergo what sounds like a pretty big deal surgery. The thing you need to know about the medications that are all advertised is that they're very expensive. And that price just seems to be creeping up rather than declining. The other thing to know before taking these drugs is only 60 or 70% of men will respond to them. And some insurance companies will pay for this, and many will not. An alternative that's recently become available, like in the last 6 months, is that we are now able to work with some pharmacies to prescribe some generic versions. And that seems a little more palatable for the patients. Instead of $30 a pill, they're like $5 a pill. Beyond that, it's sort of a conversation that has to happen with the patient and his partner. There are medications, there are drugs that when injected literally into the side of the penis will enhance the blood flow. In fact, you don't have to have any erectile capabilities. This will almost always achieve a good response. And then should that fail, or should patients just decide they don't want to have needles in their penis all the time, then we still revert to what was performed first in the early 1970s, and it's the penile prosthesis. In my practice, we've had a really good success rate with the surgeries, meaning they work for a long time, they don't cause infections, and honestly, again, the satisfaction rates are high.